Welcome everyone to the Head and Neck Connect series on swallowing and nutrition for head and neck cancer caregivers. We know that navigating the challenges of eating and swallowing during and after cancer treatment can be incredibly tough, and you, as caregivers, play a vital role in supporting your loved ones. This video is designed to provide you with practical information, strategies, and support to help you through this journey. Today, we are incredibly fortunate to have two leading experts join us. First, we have Dr. Lisa Evangelista. Dr. Evangelista is an associate professor and director of speech pathology at the UC Davis Medical Center. She is board-certified specialist in swallowing and swallowing disorders, actively involved in clinical practice, research, and education. Her research focuses on improving functional outcomes after head and neck cancer treatments, and she's published numerous articles and book chapters on dysphagia. We're also thrilled to welcome Jaime Tucker. Jaime is an adult oncology dietitian with several years of experience specializing in ENT and enteral nutrition. She's also a certified health coach, skilled in helping patients overcome eating challenges during radiation therapy. We're truly honored to have both of them share their expertise with us today.
I'd like to thank the Head and Neck Cancer Alliance for the opportunity to discuss swallowing changes throughout the journey of head and neck cancers. And so with this presentation, we're going to cover some of the common side effects of head and neck cancer treatments and how they may impact swallowing function, but also how to mitigate some of those side effects so you can continue swallowing, eating, and drinking throughout your cancer journey. Head and neck cancers are a heterogeneous group of tumors, meaning that they vary in size, location, and impact on function. So starting from the most front of the mouth to the most top of the mouth, we're going to work our way down through the throat by discussing cancers first of the oral cavity. So these include tumors of the tongue, the gum line. Moving down to salivary glands, these can be tumors of the parotid glands. Cancers of the nasopharynx or the soft palate, to cancers of the oropharynx, which are some of the most common cancers that we see here in the United States, with cancers being along the base of tongue and also the tonsils, cancers of the larynx or the voice box, the thyroid or the hypopharynx, or meaning the area close to the opening of the esophagus. So let's delve into a little bit about the epidemiology of head and neck cancers in the United States. Head and neck cancers account for 3% of all cancers in the US. Unfortunately, there's been a dramatic decrease in cancers of the larynx or voice box and the hypopharynx, with about a 50% decline in these two cancers because of lifestyle changes. So patients have reduced smoking, they're not drinking as much, which has led to this really positive decline in cancers of the voice box and the hypopharynx. However, there's a more staggering increase in HPV positive cancers, or cancers caused by the human papillomavirus, which tend to occur in the oropharynx. So looking at the tongue base, but also the tonsils. And when we look at the cancer incidence of that HPV-related cancers, we can see that there's actually a 225% increase between the years of 1988 and 2004. So it's really the most common type of cancer that we are seeing in the United States when it comes to head and neck cancers. And let's talk a little bit about the changes in trends of lifestyle factors and also how that relates to the changes in the types of cancers we are seeing for the head and the neck. And really the paradigm shift in the primary site distribution from the larynx back in the day due to tobacco use, now to more common day what we're seeing, cancers of the oropharynx, really parallels the shift in lifestyle trends. And so when we look back in the 20th century, predominantly a lot of patients used tobacco products, so smoking, chewing, and then fortunately there's been an addition in 1964 of the Surgeon General warning on tobacco-related products, warning consumers of the carcinogens within these products and the cancer-related effects that may occur when using tobacco-related products. And that led to a steep decline in tobacco-related cancers because patients were much more aware. Consumers are aware of the ill consequences of smoking, using chewing tobacco product. But then when we fast forward to the 1980s, HPV-related cancers, or the human papillomavirus, became more heavily involved in the types of cancers that we're currently seeing in this day and age. Along with the change in patterns of the types and locations of cancers we're seeing, the treatment for these cancers has also evolved. In the 1800s to the early 1900s, the only cure for head and neck cancers were these really large, gross, and debilitating surgeries. There were no reconstruction techniques, and patients were often left disfigured. But as technology and techniques have advanced, so have the options for surgical cure. And in the late 1900s to the early 2000s, we've now moved towards an era of organ preservation, or keeping the organ intact, so not doing such large surgical resections, and then also helping to preserve the organs with use of multimodal therapies, so the use of chemotherapy, radiation, and the two of those combined being chemoradiation therapy. Swallowing function may be hindered from a number of factors. It may be hindered by the cancer itself or the treatment for those cancers. So looking at tumor size and location. For example, if you have a tumor of the tongue that is quite large, that may impact your ability to chew food well or manipulate food in your mouth appropriately. Tumors, depending on where they are located, may also cause significant pain that may hinder your ability to eat and drink normally. When we look at other treatments such as surgery, radiation therapy, and chemotherapy, those all individually can cause some difficulties with swallowing. Then we look at treatment-related factors. So even though the treatment can be curative or palliative to help reduce tumor burden, those treatment options may result in difficulty swallowing. For instance, when you undergo radiation therapy, that radiation may cause sores in the mouth that are quite painful, what we call mucositis. In addition, as you go through chemotherapy and radiation therapy, you may experience some taste alterations. So oftentimes it's reported that patients say, oh, my sense of taste is very diminished, or everything kind of tastes like cardboard, or everything has a hyper salty taste. In addition, dry mouth is a very common side effect of radiation therapy and may kind of give you that cotton ball taste in your mouth, in which it makes food tend to stick to the tissues of the mouth and the throat and make it really quite difficult to swallow. And when we think about appetite, the effects of chemoradiation can suppress appetite and make you not want to eat as much. And swallowing difficulties can arise from much more than the tumor or its treatment. There can be a cascade of swallowing impairments that are seen. So for instance, if you are currently undergoing radiation therapy, you can have increased thick phlegm or mucus production that really hinders your ability to even want to swallow your saliva. And then you go on to develop sores in the mouth called mucositis that can be quite painful. Or if you have taste changes that make food really unpalatable and you lose the desire to eat and drink to sustain your nutrition and hydration, paired with dry mouth that kind of gives you that real sticky sensation in the mouth, that may impact your ability to want to continue to eat or even desire to eat. You then may also have poor oral hygiene or poor oral care because of the sores in the mouth. You can't stand to have a toothbrush rub up against your gums or tolerate the toothpaste. It can be quite painful. But then that unfolds then to leading to decreased intake by mouth. You have the sores in the mouth, things don't taste great. You have an overly dry mouth, so it makes it hard to eat solid consistencies. So you end up having a decreased amount of eating by mouth. But then, unfortunately, that may lead you to needing a feeding tube for supplementation for your calories. But also those sores in the mouth, the increased mucus production, the lack of energy from not having enough nutrition and hydration can then also impact your ability to perform prescribed swallowing exercises throughout your treatment. And then unfortunately, because you're no longer using the muscles for eating and swallowing or doing the swallowing exercises, you start to lose muscle mass or have weakening of the muscles involved with your swallowing. So as you can see here, it is a cascading effect of what can cause difficulty swallowing along the continuum of your treatment. But have no fear. You certainly want to be in the hands of a speech pathologist while you're going through your treatment, because they're going to be the professionals that know the most about swallowing in terms of assessment and evaluation, treatment, and how to get you through your treatments as tolerable as possible. So first and foremost, it's always good to have your swallow evaluated, and there's a couple different ways that evaluation can take place. There are two different types of instrumental evaluations that can provide clinicians and yourself as a patient and caregiver the real-time ability to look at your swallowing function. So probably the most popular way and most commonly performed instrument to evaluate swallowing is a video fluoroscopic swallow study, also known as a modified barium swallow study. This is an X-ray movie of your swallow in which you will swallow a contrast called barium, which is a radio-opaque contrast that allows the clinician to look at the anatomy and the function of your swallowing. Similarly, another way to look at your swallowing function is with an endoscopy. Provides a bird's eye view with a camera called a fiber optic endoscopic evaluation of swallowing. Both of these evaluations will allow the clinician to look at your anatomy, your physiology, determine if there are any impairments, and what can be done about those impairments. And so the purpose is multifactorial. The purpose is to see if there's any changes to the anatomy, whether that be from the tumor or from the cancer treatment itself, such as surgery or radiation therapy. These tests can also identify swallowing function or deficits in that swallowing function, such as are you aspirating or having liquid or food going down into the windpipe? Or are you having issues with residue or food or liquid left over in the throat because the throat isn't squeezing as efficiently as we would like it to? It also determines whether or not certain compensatory strategies are effective. So for instance, if you had a surgery of the left side of your throat and the left side isn't squeezing as well as the right side, and so when you go to eat some applesauce or you go to eat some pudding, you have a lot more left-sided residue, your clinician may instruct you to do a left turn over your left shoulder to help divert that food and liquid over to the strong side, the right side, by shunting off the left side. The purpose also of these two evaluations is to help determine what diet textures are appropriate for you. So what can you do? Really what you can do throughout your treatment is to continue swallowing. Really think about swallowing as a use it or lose it function. You want to continue swallowing to help prevent muscle wasting. And that means that even if you have a feeding tube, eating and drinking by mouth is important to continue using the musculature of the head and the neck. And so we always encourage patients that are on a feeding tube that they should eat and drink by mouth first and then supplement with tube feeds, because if you put the tube feed in first, you're often going to be really full and not want to eat and drink by mouth. So first eat and drink by mouth if you have a feeding tube, and then put in your tube feeds. Even if patients are aspirating, which we know and we're going to talk about a little bit, can be a scary thing. But in order to prevent muscle wasting, you should continue to swallow water, because what we actually know is that water is the most benign substance to enter the lungs and doesn't cause lung infections such as an aspiration pneumonia. And then your clinicians, your speech pathologists, can give you proactive swallowing exercises to do throughout your chemo and radiation treatments to help preserve your swallowing function. So why are eating and drinking so important? When you look at the literature, patients who eat and drink by mouth and also perform swallowing exercises that their speech pathologist gave them throughout chemotherapy and radiation therapy, or just radiation therapy, these individuals are much more likely to return to a regular diet and have decreased feeding tube dependence when we think about the long term. And that's why it's always important to think about is, what is my end goal? And really thinking about your long-term goal and how you can achieve that through eating and drinking. And so really reframing eating and drinking as serving two different purposes, because we know that taste is not going to be great. It's often painful when you're going through radiation therapy. So by putting eating and drinking in two separate boxes, you can help achieve your goal. The first box is to eat to achieve nutrition and hydration. So these are going to be your easier textures. These are going to be like your liquids, your purees, things like Ensure and Boost that are much easier to get down. You can get a lot of bang for your buck in terms of calories, but they're not really going to challenge the system. Then we move over into our second box, in which we're eating and drinking for practice and maintenance of your swallowing function. So these are going to be where you start to challenge yourself with more difficult textures, such as really soft foods like fish or cooked stewed vegetables, something that probably isn't going to be the most enjoyable to eat in terms of taste and pain, but will keep your muscles in tip-top shape. And really the goal is to eat all the way through your radiation therapy. But what if side effects get in the way of my ability to eat and drink? Well, I really think it's important to normalize the side effects of chemo and radiation therapy. Oftentimes, if you develop sores in the mouth or you lose your taste, it's often easy to be concerned that these are not normal side effects. But majority of patients who undergo radiation therapy or chemoradiation therapy will experience these side effects, usually at the end of the second week into the third week of treatment. And because radiation is cumulative, you will likely have a compounding effect in which at the end of radiation and about 2 weeks after, these side effects may be at their worst. And so ways to help mitigate these side effects, we'll take it one by one. Looking at sores in the mouth and mucositis, we always encourage patients to do a baking soda and water rinse several times a day. You can apply a topical viscous lidocaine right before eating or drinking, because it can help take some of the sting away when you have sores in the mouth. Also, always talk to your radiation oncologist or medical oncologist about the use of pain medications. They probably have anything in their arsenal from an ibuprofen or Tylenol all the way up to fentanyl patches or morphine. So you certainly don't want to be heroic while going through your treatment, and communicate with your physicians about optimal pain management regimens so you can continue to eat and swallow. Also considering altering your food textures to a texture that's a little bit more easy to be swallowed. Dry mouth, so you really want to drink water, stay systemically hydrated, and use over-the-counter products that contain ingredients such as xylitol or hyaluronic acid. And you can get these in all different types of forms, such as a mouthwash, a spray, a mouth gel, or lozenges that you can use throughout the day. Mucinex can be used to help loosen some of that really thick phlegm, that thick mucus, and also staying systemically hydrated can help thin out the viscosity of that mucus so it's more easily swallowed. When it comes to taste changes, unfortunately, there's no great magic wand that can help speed the healing of this. So keep an open mind. Experiment with different food textures, different food tastes, because foods that you may not have liked before you actually may like. And really, patience is a virtue when it comes to taste improving after radiation therapy, because it does take several months for taste to start to come back. And you may develop difficulty swallowing in which you feel like you are coughing and choking when you eat and drink. And this is typically called aspiration, or when food or liquid goes down into your windpipe. And I think it's actually good to know that aspiration is a common occurrence, particularly when you are radiating really sensitive areas such as the head and the neck. But aspiration is quite a common event. We all aspirate from time to time. You know, if you're indulging in your morning coffee and talking with a friend and you get into a giggling fit, one of you may aspirate and cough. And it's also interesting to know that we aspirate quite a large percentage of our saliva when we're sleeping and never go on to develop a consequence of that, such as an aspiration pneumonia or a chest infection. And so most of the time, aspiration doesn't have a negative consequence. For patients who are at risk, they may develop a chest infection if they do aspirate. So let's talk about some of the risk factors for the development of an aspiration pneumonia. Number one, poor oral hygiene. Aspiration pneumonia occurs not because of the food or the liquid that enters the lungs, but because of the bacteria that's in the mouth that goes down with the food or the liquid. So your first line of defense is really good oral hygiene. A feeding tube is actually a risk factor for aspiration. A lot of patients will say, well, I'm going to get a feeding tube so I can't aspirate. But you can still aspirate your saliva, and you can actually aspirate refluxed tube feedings. Being dependent for care is a risk factor for development of aspiration pneumonia. So if you are dependent on someone to feed you, or if you are dependent on someone to keep your mouth clean, those are independent risk factors because they may be performing these duties at a speed that you're not comfortable with. Gastrointestinal disorder or disease, such as reflux, if you have stomach content coming up through your esophagus, it can spill over into your airway and you can aspirate that. Or pulmonary disorders or diseases such as chronic obstructive pulmonary diseases, this may cause some difficulty with being able to tolerate anything going into the lungs. But I think it's really imperative to know that the event of aspiration or the event of something going down the wrong pipe alone is not sufficient enough to cause a chest infection like an aspiration pneumonia. You have to have certain risk factors that predispose you to the development of such a disease. As I mentioned, oral hygiene is the best defense against development of an aspiration pneumonia. And if you don't keep your mouth nice and clean, unfortunately, that puts you at risk of developing more hostile or virulent bacteria in the mouth that can cause a chest infection if taken down when aspirated. And lack of proper oral hygiene can worsen your taste changes and dry mouth. And so it's always recommended to perform oral hygiene with a soft bristle toothbrush by brushing the teeth, the gums, the surface of the tongue for 2 minutes twice a day. If you can tolerate flossing, that's also recommended. Use of a non-alcoholic mouthwash can be beneficial, and we say non-alcoholic because alcohol can be drying to the tissues of the mouth, And when you're going through head and neck cancer treatments, you're likely already dry at baseline and don't need something else to dry your mouth out even more. And if you are sensitive to mint in your toothpaste, because the sores can be really sensitive to menthol, you can switch to a children's toothpaste like a bubble gum that can be less offensive to the mouth. And really, I think it's important to know that swallowing difficulties can occur along the continuum of treatment. You can have difficulty swallowing before your treatment just from the tumor itself. The treatments such as radiation therapy or surgery can result in some difficulty swallowing. And even after treatment, long-term changes can occur. And so it's really important to reach out to your speech pathologist to get a proper evaluation for diet selection, education of what's going on with your particular swallowing and how to optimize that, and what to look out for in terms of long-term changes over time. So I'm really appreciative of the opportunity to present at the Head and Neck Cancer Alliance on swallowing function. And if you have any questions, please feel free to reach out to myself or to your local speech pathologist. Thank you.
Hello, my name is Jaime Tucker. I'm a registered dietitian at the UC Davis Medical Center Radiation Oncology Department. Today we'll be talking about nutrition for caregivers. So we'll discuss tips for how you can best support your loved one's nutrition as they go through treatment for head and neck cancer. Patients with head and neck cancer face numerous nutritional challenges due to both the cancer itself and its treatment. So the cancer and tumor location can often cause difficulty swallowing, inflammation, and increased nutrition needs. On top of that, treatments such as surgery, chemo, and radiation often make eating more challenging due to the side effects like mouth sores, dry mouth, altered taste, and low appetite. When eating becomes painful and no longer enjoyable, it can lead to emotional and social barriers. So you may begin to notice patients might isolate themselves, lose interest in food, and many could experience anxiety or depression, which further reduces their motivation and ability to eat well. So altogether, these factors place patients at higher risk for significant weight loss, muscle wasting, and ultimately malnutrition. So caregivers can help patients to navigate these challenges to provide them with that emotional support to help patients to eat, stay strong, and feel supported during this difficult time. So why does nutrition matter? Well, when patients don't eat well, they don't feel well, and that makes it really hard to tolerate treatment, often leading to worsening fatigue, weight loss, and even treatment delays. So proper nutrition keeps patients strong, enabling them to stay on track with their therapy, which is crucial for achieving the best possible outcomes. It also reduces the risk of malnutrition and supports the body's ability to heal and recover during and after treatment. So, in short, good nutrition is critical for improving both the patient's quality of life and the effectiveness of treatment. The caregiver plays a vital role in supporting patients throughout their treatment. So eating may not be enjoyable during this time, but it is absolutely essential. Caregivers can help by encouraging patients to eat, reminding them of its importance, and reducing barriers by preparing meals, doing grocery shopping to ensure that nourishing foods are always accessible. Caregivers also monitor intake and ensure that patients are getting proper nutrition, and they can communicate with the healthcare team if the patient isn't getting enough. They help to manage symptoms by adjusting the diet and medications to address side effects like pain, nausea, and constipation, so patients can continue eating despite these challenges. So I really like to think of treatment kind of like a roller coaster. As side effects rise and they fall, we have to constantly adapt to help manage and improve their tolerance to keep patients eating. So even as symptoms worsen, they can continue to eat. As caregivers, you're really strapped in for the ride and navigating with each twist and turn to support patients and help them to get through this challenging journey. So with the right support, patients are more likely to meet their nutrition needs, maintain their strength, and better tolerate treatment. The main nutrition goals during treatment are to minimize weight loss and prevent malnutrition. We say minimize weight loss because it can be really challenging to prevent it altogether, but we do want to keep it to a minimum to prevent or delay developing malnutrition. Treatment places a lot of stress on the body, so patients do need more calorie and protein needs than usual to stay strong and support healing. Hydration is also just as important. Staying well hydrated helps to protect the kidneys, especially for those undergoing chemotherapy. Dehydration can also make side effects like fatigue, nausea, constipation, and dry mouth worse. So drinking enough fluids is key to managing these symptoms. Always talk to your dietitian. They can provide you with personalized nutrition and hydration goals based on the patient's medical history and treatment plan. As patients go through treatment for head and neck cancer, various side effects can make eating challenging. So we'll review each of the side effects and some tips that you can do to adjust their diet so that they can continue eating. When patients are dealing with a dry or sore mouth, there are food adjustments that can make eating much more comfortable. So first, we want to avoid any spicy or acidic foods as it can really irritate the mouth. So that means things like tomato sauces, vinegar-based condiments like mustard or ketchup even, as well as citrus fruits should be limited or avoided if it's bothering the patient. Instead, you can opt for things like creamy sauces like Alfredo or pesto, switch to mayo or ranch as a condiment, choose low-acid fruits like bananas, applesauce, or even pears and blueberries. Adjusting the texture is also key. We want foods to be soft and moist. You can cut the foods into small pieces, mash or puree, or even blend the foods until they're totally smooth to help with chewing and swallowing. We want to avoid dry, crunchy, or sharp foods that can hurt the mouth. A good tip can be to add extra sauces or gravies or broth or even oil to moisten the food. The good news is that also increases the calories, so it's kind of a 2-for-1. If patients are really struggling with the dry mouth, some find that coating the mouth with a small spoonful of oil like coconut or olive can help to make food slip down a little easier and really reduce discomfort. We also want to avoid, really extreme temperatures. So anything too hot or too cold might irritate the mouth and the throat. So just room temp foods or slightly cool foods tend to be better tolerated. And of course, staying well hydrated is going to help to moisten the mouth. So encouraging things like electrolyte drinks, tea, coconut water, juice, whatever you need to keep our patients hydrated. So taste changes are a common and frustrating part of head and neck cancer treatment. When food doesn't taste right, eating can really feel like a chore. And unfortunately, there's no quick fix, but there are some diet modifications that can help. So you can try boosting flavors with herbs, seasonings, sauces, or marinades. Even adding a little extra pinch of sugar or salt can help foods to taste better. If things are tasting metallic, you can have them use a plastic or wooden utensil. Definitely avoiding canned foods, choosing boxed or homemade options instead. Finally, adding a bit of sweetness, like a little bit of barbecue or teriyaki sauce, can help to mask that metallic taste, especially on things like meat. It may also be good to avoid their favorite foods for now, just to avoid disappointment. It can be a really good time to try new foods or stick to just bland, soft foods instead. Foods like cream of wheat, mashed potatoes, scrambled eggs, pasta with butter, or Alfredo sauce tend to be well accepting. If something works, just go ahead and stick with it. There are really no rules during treatment. If they want a milkshake for dinner or soup for breakfast, whatever sounds good, we're willing to have them eat. Finally, sugar-free candies or lozenges can help to kind of help with an off taste in the mouth between meals. And then also performing a baking soda or mouth rinse before eating can clear any thick phlegm in the mouth and reset the taste buds. So nausea and vomiting can occur, especially for those undergoing chemotherapy. If your loved one is feeling nauseated, it's important to adjust the diet to be small and frequent meals. Eating every 2 to 3 hours helps to keep the stomach from getting too full or too empty, both of which can make nausea worse. We want to stick to bland, easy to digest foods like oatmeal, cream of wheat, rice, applesauce, bananas, chicken noodle soup, crackers, or mashed potatoes. Avoiding greasy or high fat or high fiber foods, as these foods can slow digestion and worsen symptoms. So now is not the time for a big leafy salad or a big greasy burger. We want to keep things nice and bland. Make sure that they're sipping fluids between meals to stay hydrated without making them feel too full. Since strong smells can trigger nausea, caregivers can really help by cracking a window or using a fan during meal times. Cool or room temperature foods are often better because they produce less of an odor, so you could stick to those if it's really bad. Sometimes diet alone isn't enough. Anti-nausea medications work best when taken on a schedule, not just when the symptoms hit. So it's much harder to get rid of nausea once you have it, so starting ahead of it is key. Finally, don't overlook constipation. It can really make nausea worse, so using stool softeners or laxatives might be needed to help keep things moving. It's no surprise that low appetite and weight loss are common challenges during treatment. When food doesn't sound or taste good and swallowing is painful or difficult, normal hunger cues often disappear. This is where the caregiver's role becomes especially important. Help your loved one to shift their mindset around eating and begin to view food as part of the treatment plan. It becomes like a prescription, just as important as taking their medications. Instead of waiting for their hunger, offer small, frequent meals every 2 to 3 hours, aiming for 5 to 6 snack-sized meals per day. Prioritize soft foods that are easy to chew and swallow. Because their meal sizes are typically smaller, focus on making every bite count by layering extra calories and protein into each meal and snack. Finally, nutrition shakes can be a helpful way to fill in the gaps and prevent and minimize weight loss. It's not uncommon for patients to be drinking several of these per day to support their intake. This is a great list of nutrient-dense foods that pack a lot of calories and protein into small portions. To boost calories, try adding oil, butter, heavy cream, or cheese to soups, pastas, or scrambled eggs. Smoothies can be enriched with nut butter, chia or flax seeds, coconut milk, or even a scoop of ice cream. Tuna or chicken salad can be mixed with mayo, avocado, or salad dressing, and choosing full-fat dairy options add even more nutrition value. For protein, the goal is to prioritize soft, easy-to-chew sources like dairy, ground, shredded, or canned meats and fish, eggs, tofu, or beans. To boost the protein intake of meals, swap almond or oat milk for higher protein soy milk. Use bone broth as a base for soups. Stir cottage cheese into scrambled eggs. Mix peanut butter or protein powders into oatmeal. Or add canned tuna or chicken to casseroles or mac and cheese. The key is don't hold back. Even small amounts can add up to a big difference in supporting healing, maintaining strength, and preventing weight and muscle loss during treatment. These are some examples of soft, easy to chew foods that are nutrient dense that have worked well for patients as they go through head and neck cancer treatment. I hope that you'll find this list helpful and give you ideas for things that you can serve your loved ones. I wanted to take a minute to talk about nutrition shakes because they can become really important during treatment. And with so many options at the store, I know how overwhelming it can feel to choose the right one. So side effects like pain, difficulty swallowing, dry mouth, and taste changes can make eating really challenging. So many people find it easier to drink a nutrition shake instead of having to eat a full meal. It's not uncommon for these shakes to become a staple in someone's diet during treatment, so it's important to make sure you're choosing the right one that meets your loved one's needs. Most of the shakes that you'll see at the store shelves are protein shakes. These are typically low in calorie, only containing about 150 calories, but they have a lot of protein at about 30 grams. These are okay as a snack, but they're not enough to replace the full meal. You can boost their calorie content by blending them with ingredients like nut butter, yogurt, fruit, or even ice cream. You can mix them into the foods the patient is eating, like oatmeal or cream of wheat, to boost the protein content. A more complete option would be a high calorie or plus nutrition shake. So these are options like Ensure Plus, Boost Plus, Equate Plus. These have at least 350 calories and about 15 grams of protein. There's options like Boost Very High Calorie or Inu, which often offer even more at about 400 to 530 calories per serving. So these are even more suitable options as meal replacements. For those who prefer a plant-based option, I'd recommend something like Kate Farms or Soylent. These have at least 300 calories per serving, so they're more nutritionally complete than many other plant-based shakes out there. Please do not hesitate to bring the shakes you're serving the patient into clinic, so that way the dietitian can review them. We know that having the right shake can really make a difference in the patient's nutrition and success during treatment. In addition to diet changes, there are other supportive practices that can really help to manage treatment side effects and support nutrition intake. First, baking soda rinses before and after eating can help keep the mouth clean, reduce irritation, and even improve taste. These can be performed as often as necessary, often 8 to 10 times per day, as they often provide a lot of relief and clear the mouth from any thick, dry mucus. A humidifier can also soothe the dry mouth and throat by adding moisture into the air you breathe. There's some evidence that glutamine rinses, typically 10 grams, swished and swallowed 3 times a day, may help to reduce the severity of mouth sores. While they may not prevent sores entirely, staying consistent with them can make a noticeable difference. It might be something worth adding if your loved one is open to it. Lidocaine can also be used before eating and drinking to numb the mouth. You can either dilute it and use it as a swish, or also use it as a spot treatment to rub on specific mouth sores that might be irritating as they eat. It's also important to be mindful of food safety, especially when the immune system is weakened from chemotherapy. As you care for your loved one, make sure you practice safe food handling. So wash your hands and produce thoroughly, avoid cross-contamination in the kitchen, cook all meats to proper temperatures, and toss any leftovers after 48 hours. Please feel free to ask your dietitian about more food safety tips if needed, especially if your loved one develops what's called neutropenia, which indicates that they are at higher immunocompromised risk. Hydration is extremely important during treatment, especially for those receiving chemotherapy. Staying well hydrated can improve energy, reduce side effects, and help the body to tolerate treatment better. A general rule is to aim for about 64 ounces fluid per day, but your dietitian can provide a more specific goal, as some people may need more or less than this. And remember, it doesn't all have to be plain water. Fluids like electrolyte drinks, coconut water, juice, tea, milk, and even popsicles all count towards your daily intake. Tracking fluids can be helpful, especially if your loved one isn't feeling thirsty or tends to forget to drink throughout the day. Using a water bottle with measurements on it can also help to keep them accountable and make it easier for them to meet their hydration goals. Feeding tubes can be an essential source of support during treatment, especially when swallowing becomes too difficult or if the patient is losing too much weight. They help maintain nutrition and hydration so your loved one can stay strong, better tolerate treatment, and recover more smoothly. Think of a feeding tube like a life jacket. It helps to keep someone afloat when swimming becomes too hard. In the same way, a feeding tube provides critical support when eating becomes too challenging. It's not a sign of giving up, it's a temporary tool to help get through the hardest part of the journey. Feeding tubes can be placed before, during, or after treatment, depending on the patient's needs. There are different types: nasogastric tubes, which go through the nose into the stomach, and G tubes, which are placed directly into the stomach. The dietitian will closely monitor nutrition and feeding tolerance, making adjustments as needed. Remember, this is often temporary. Many patients return to eating by mouth as they heal. Keep an open mind and maintain an open dialogue with your healthcare team. They're there to support you and help make the best decision for you and your loved one every step of the way. As a caregiver, one of the most meaningful ways you can support your loved one during cancer treatment is by helping them to stay nourished and hydrated, even when it gets tough. The key is to remain flexible, proactive, and compassionate. Treatment comes with many ups and downs, and it's completely normal for eating habits to shift from day to day and week to week. The goal is to adjust their diet based on how they're feeling, helping to manage side effects, minimize weight loss, and support their ability to tolerate treatment. Prioritize calories and protein to support healing and to prevent weight loss. When eating becomes difficult, nutrition shakes can help fill in the gaps. Hydration is also just as important. Staying well hydrated helps to prevent dehydration and improves tolerance to treatment. If a feeding tube is recommended, remember, it's not a sign of a failure. It's a proactive tool that can help to prevent complications and maintain strength during a challenging time. Finally, don't hesitate to lean on the care team. They're there to guide decisions and offer support every step of the way. Your role as a caregiver is invaluable. The care, comfort, and encouragement you provide can make all the difference in helping your loved one get through treatment and onto the path to recovery.
Thank you for joining us today for this important topic. If you have any questions, feel free to reach out to us via email at connect@headandneck.org or visit our website for more details, www.headandneck.org. We hope that you'll join us next week for our online discussion, where you will have a chance to chat with other caregivers and professionals about these important topics. It's an honor to connect with you. Wishing you strength and peace in the week ahead.